So welcome back. This next episode, we're going to discuss with Dr. Tam long COVID fatigue. So Dr. Tam, what would you say the symptoms are that characterise the manifestation of fatigue associated with a COVID-19 infection?
Hi, thank you for, let's explore that a little bit, because there's been a lot in the media about post-viral fatigue and chronic fatigue syndrome, ME, and how it's similar to post-COVID. I think there's a distinct difference, and we'll explore that. But the fatigue that people are experiencing, it's quite a deep fatigue, and it's in the muscles, it's in the joints, it's related to inflammation. It's also related to the fact that a lot of people with the longer COVID symptoms do have trouble sleeping. And if you're not having deep sleep, then you're not really regenerating yourself. So we really have to get people, sleeping. And that can be a number of things that can help there. Specifically speaking to your doctor about melatonin, we know that it's an antioxidant. It can really help support sleep, but also the inflammatory processes that happen in long COVID. So that's one thing that's really important. So people do feel very heavy. They have poor exercise tolerance, which means you feel exhausted if you've done the exercise. So, and also the whole concept of brain fog that we'll come to well, which is like brain fatigue. So it can be very different in different people, but essentially managing your symptoms and managing your sleep are very important.
Okay, thank you. So would you say that only certain individuals would be affected by the fatigue, or is there any patterns in your experience?
I think what we know is that obviously the worse you are hit by COVID, like someone like me who had double pneumonia with no respiratory problems or previous underlying lung condition, if you're the more extensive the infection in terms of its initial effects on you, the more likely you're going to have fatigue and longer time course to recovery. Also, if you go back to exercise too soon, that can set you back and the fatigue can be a lot worse. So I think, and your history as well, like if you have a history of chronic fatigue syndrome or ME or any other fatigue related condition whereby your mitochondria, the powerhouse of the cell, is impacted, then you're more likely to be affected by post-COVID fatigue. Also, if you have potentially like anemias or other syndromes or underlying conditions that can predispose you to feeling tired. So it's a good chance if you do have long COVID to get a real overhaul of your health, because it's a systemic disease and there are many things you can do which result in you feeling better in the longer run.
Super, thank you. So in terms of somebody recovering from post-COVID fatigue, do you have any nutritional support protocols or advice that you could give?
Sure, I can split it into nutrition, supplements, and then some lifestyle recommendations. So nutritionally, we know that the lower the refined component of the diet, the better. So we want to really get off these quick fix foods, artificial sweeteners, etc., and really looking at nutrient dense food as close to the land, organic. If you can, I know that it's an expensive world, the organic food world, but cooking as close or having someone cook for you that's really getting some good quality in there. And that is, easy to digest foods as well, root vegetables, soups, broths, smoothies, potentially getting a high polyphenol mix in there, which is, the blueberries, the chestnuts, the pomegranates. I developed like a craving for red onions, raw red onions, which we know are really high in quercetin, which is an anti-inflammatory. So I'm literally eating raw onions and have been for 10 months. And I find myself craving it. But so that's one thing. Also veer towards the low histamine side of things, which I've mentioned that a lot of people who have inflammation in COVID have histamine release, which results in joint swelling, sort of rashes. I had like quite a lot of periorbital edema in my face. So reducing histamine, and that's difficult if you're someone like me that loves avocados, red wine, balsamic vinegar, tomatoes. I mean, they are all high histamine foods. So really try and veer towards, and there's a lot of information out there on low histamine diets. Dr. Tina Piers has written a lot online if you want to look her up. So that's nutritional side of things. Don't eat too close to bed, because that's going to impact your body temperature and hence your deep sleep. For some people, intermittent fasting can help really give you a gut reset overnight, 12 to 16 hours. And then supplementary support. What we know is that we know that there's depletion of the antioxidant. To twist it a little bit, there is an increased need for antioxidants in the diet because they are depleted in the infection. So I would be looking at, as I mentioned in the other video, N-acetylcysteine is a really good one. We now know that niacin at a bigger dose, we're talking like starting at 50 milligrams and upwards, and it may cause you to have a flush. Can increase your what we call the NAD pool, and NAD is important in mitochondrial function, which are essentially the little organelles that create energy. So you really want to boost up your niacin, potentially looking at NMN, nicotinamide, I can never say it, NMN, which anything that boosts NAD, and then more formal mitochondrial support like MitoQ, so ubiquinol can support the mitochondria. I use carnitine as well. And then if you can afford it, looking at that ketone ester, which gives you exogenous ketones. And those are the main things really. And then making sure you sleep. So I mentioned melatonin, magnesium, a sleep routine. And then looking at more lifestyle means. So I found really helpful is I invested in an infrared sauna. So I've been in there most days. And, you know, especially as we're all kind of locked in at the moment, it's really nice to be able to go in and get exposure to the red light, which we know has an impact on your mitochondria. You also get a slight sweat because it's a low temperature relative to a dry heat sauna. It's not that stressful on the system. So I found that really helpful. And also, you know, just pacing, as I said. So when the days that you feel better, and I'm classic overexerter and I always get this wrong, you don't go out for a 10K walk, you know, just keep it shorter. Come back from exercise feeling okay, not exhausted. So those are the main things. And prioritizing your relationships as well, like really looking at what support structure you have, you know, because I don't think it's been talked about enough, that it's a really anxiety provoking time having COVID. You know, for me, who's always kind of taken my body for granted, it was pretty terrifying to have a range of symptoms, you know, palpitations, you know, nightmares at times, sweats, joint swelling, breathlessness. These are all really, you know, anxiety provoking symptoms. So don't be worried about being a burden on people. Ask for help, really get as much support as you can, because this is not to be messed with in some people. And if you think I'm 10 months down the line and still impacted, you know, really throw everything at it in the early stages if you get this to be well.
I mean, it's really looking like some people will need a rehabilitation program, won't they? You know, with clinical care.
I think so, and I think, you know, me, like others, were dismissed as saying, oh, you know, it's just post-viral fatigue, or it's this and this. You know, we as medics, we love to box things. We need to understand things, so we need to put it in a diagnostic category. And I remember thinking, but this isn't post-viral. This doesn't feel like fatigue. You know, I can't sleep. I've got a racing heart. It's all over the shop. I keep getting these flares of chest pains, which we know because I had inflammation in the lung, and then that sets off this cascade. So people really need to be listened to and not palmed off with antidepressants. I think antidepressants can play a role because they can increase serotonin, which can reduce your myalgia symptoms, that muscle ache, that deep, and your mood. But really, you know, looking at resources online, because, you know, GPs are really busy, and, you know, there have been long COVID clinics set up, but I haven't been referred to one. You know, they are still seemingly rare, although very much needed, because if anything, this is telling us that a lifestyle medicine approach to disease is so necessary right now. Looking at your nutrition, looking at the way you move, a graded exercise approach, but really not pushing it, because if you do that, you know, as I said, you get set back. And then the psychological support, you know, just being listened to, and rebuilt, I think, is super important.
It's really great to hear that you've had some interventions that have had a real positive impact and helped with your recovery. Which would you say has been the most impactful?
I would allow yourself to rest, but to get a routine in your life where you do some mild activity in nature and breathing, really refocus on how you can restore your nervous system to feel safe again, because in a position of safety, everything else will eventually heal. So I think that would be the main thing I would recommend, is to just really prioritize rest, seek help if you need with your sleep, and then spend time in nature and breathing and with your loved ones every day.
Thank you very much. That was really useful. Thank you.